Does repeated scaling damage our teeth? From Cora.
Okay. So repeated scaling, does it damage your teeth? What the person is referring to scaling means the deep cleaning. As periodontists, we do deep cleaning in our offices on a very regular basis. So even some of the health insurance companies, they know that the scaling and root planing sometimes needs to be repeated every 2 to 3 years. So they have some stipulations built in their insurance and the limitations built in the company. So they allow the deep cleaning, as you know, every 2 to 3 years. And so going back to the question, so can it damage your teeth? Absolutely, it won't damage your teeth if it is done right. That is absolutely not a problem. But how often do you need to repeat that? That's what people get confused with. And this is what I tell people. What is the difference between a deep cleaning and a regular cleaning? So when patients come to my office, this is something that I talk about, like, almost like a broken record, over and over and over all the time. Imagine you have to drive a car and you need to maintain the car, right? So maintaining the car meaning like two things. One is you have to have your regular oil changes every 3 to 6 months, depending on the manufacturer recommendations. And then not because you are doing the regular oil changes every 3 to 6 months, you cannot skip the major tune-up. Right?
Yeah.
So the 30, 60, 90,000 mileage comes, the tune-up or the oil change or the major maintenance comes, it has to be done, no matter whether you do your 3 months or 6 months oil change. Imagine somebody doing those two things properly, but they are racing their car all the time. And again, because they are not driving properly and now they have to maintain at a different schedule, right? So these are the three things that come into play when it comes to maintaining a car. Same thing. Depending on how good you maintain your teeth, whether you brush, whether you floss, whether you use the right techniques, whether you use the timer, whether you go to the dentist on a regular basis, on every 3 months if you have gum disease, or every 6 months if you don't have gum disease. A lot of things come into play depending on that. You may need the deep cleaning every 2 years. You may need the deep cleaning every 3 years. Or sometime I have patients, they don't need a deep cleaning at all for multiple years. In my case, I have not had a deep cleaning for a long period of time. I do, as I said, brush and floss my teeth, and I use multiple times and then use mouthwash and multiple different things. So I have not had a deep cleaning. However, when I get my cleanings done, I tell my patient I have a luxury of having a hygienist in my office every day. So although I don't get my teeth cleaned every day, I get my teeth cleaned every 4 to 6 weeks, sometime even sooner. So when I get my cleaning, I tell my hygienist, hey, if you see something, just go ahead and do some deep cleaning on one of those spots. And do I miss some other spots? Like, yeah, of course, yeah. So if I miss those spots in my hygiene, when I get my cleanings, I get my deep cleaning just on those 1 or 2 spots. So talk to your dentist or the hygienist next time when you go to them. Whether if you do miss like a couple of spots, they're able to do a little bit of a deep cleaning on one of those spots, or have them repeat the scaling process, or the scaling and root planing, or the deep cleaning process every 2 to 3 years or 3 to 5 years. My recommendation is, like, if you know if you have insurance particularly, and if you know the limitations on the insurance, and if you know your insurance covers every 2 to 3 years or 2 years every 3 years, and if you know you have not had it for every 2 years, check with your dentist and then see, hey, can you do the deep cleaning? Although I'm kind of a borderline, can I still get a deep cleaning? And they may be able to help you, and they may be able to answer that question for you.
All right.